to the next slide, Dr. Tosin.
Okay. That's not working, is it? 1 second.
It hasn't moved yet. So just some of the tips that we have for dealing. It's on. It's just if you can move to the next slide.
Are you seeing the next slide right now?
No, not now, not yet. It's still on the first slide.
It's moving over here.
Moving before.
Try it again.
All right, I'll just start while we're waiting for that to be sorted. So some of the tips that we have for dealing with complex stations is, first of all, you want to, even with any stations in CASC, you want to stick to the task as much as possible. So if they've asked
you sorry to interrupt. Can you see the next?
No, not yet, Tosin.
Still not moving.
No. Could you put it on slideshow? Because right now what we're seeing is file home, insert, and are you able to put it on slideshow? Then move to the next slide.
It's moving over here. Well, let me stop down to the other way again.
Might need to just reshare again and see.
It's not better now, is it?
Yeah, it's moved further ahead now. Do you want to move it back to the second?
Sounds like we've got a very special bunch of people right here. So you've all frozen my screens.
Oh, wow.
Okay, so is there any, I've got multiple, I'm just gonna have to just cancel everything. Cancel everything.
Yeah, I'll let you know when we can see it. So I don't want to waste people's time because we have an hour. So I'll just start with it. So I'll let you know when we can see it. Just keep trying. Reshare again. Okay, so we want to stick to the task as possible, whatever the task is. If they've asked you to do a risk assessment, make sure you do that. Don't take a lot of time just taking a history, then you don't do a risk assessment, because if you don't complete the task, then you won't be able to pass. You have to do the task. So that's one of the general tips. And just a tip for everyone who feels like, what's actually happening in this station and they're not really sure. What you might find out in the CASC exam is that those hidden tasks that you feel you're not sure if you've really done in the exam is usually a risk assessment. It is usually the hidden task in a complex station. So risk, as psychiatrists, we have to kind of take on a large risk burden. So we are expected to show the Royal College that we are able to do that. So it's always very important. And also you want to, I'm sure you've heard this many times, to practice reflective listening. So, and what does that mean really when people talk about that? So when the patient is telling you, this is what happened to me 2 days ago, you don't come back and ask the patient in the exam, oh, so what actually happened 2 days ago? After the patient has already told you, you use the information that the patient has said, and you can reflect it back to the patient and say, you can say, oh, Mr. Joe, you told me that this happened to you 2 days ago. Has it gotten worse? You don't want to ask the same questions that has already been answered by the simulator or the patient. So that's one tip, because if you do that, it wastes your time, number one. Number two, it hinders your rapport with the patient, because the patient is like, this doctor is not actually listening to me. They just have their own agenda, their list of questions, and so on. The other thing that you would like to do is to address the patient's concerns. Address the patient's concerns and not your own agenda. So you might have, especially this usually comes into play in management stations, where you're asked to explain a diagnosis or a treatment to a patient, and you have a list of things you want to show the examiner you have this information, but the simulator might have been given specific questions to ask. If you continue giving like a lecture, you won't be able to address the patient's concerns, and the possibility of you passing that station is lowered. So you need to be very, very careful about that. Just to check, Dr. Tosin, so what we're seeing now is the first page. So I don't know, can you move it to the second page and whether that would work?
On my screen, I can see general tips for complex stations. Is that what everyone's saying?
No. We can only see complex stations webinar. That's the first stage. So I think maybe if you've opened many screens on your system, you need to close all of them and just share one.
It's quite interesting.
Yeah, so it's not moving, it's just on the first page.
Let me see if I...
Yeah. Apologies for the technical issues this morning, but hopefully we'll still get something out of today. The other tip that you want to consider is you want to try and remember who you're addressing in the station and phrase your questions accordingly. I think the reason why I'm asking this is because I think I've had an experience in an exam where obviously people are full of nerves, isn't it? So when you read this question outside, so I thought I was going to be speaking to the son, and then I got in and it was actually the husband I was speaking to. So that created a bit of confusion. And it's normal because even in our consultations, we can make mistakes for one thing or the other. We have so many things on our mind. It's not, you don't panic at that point. At that point, you just need to say, I'm really sorry. Can I just take a look at your notes again? You're sure who you're actually speaking to. Okay. Dr. Tosin, we can see it now.
Okay, so it's on the general tips right now, yeah?
Yes, we can see it now.
Okay.
Thank you. The only thing is if you can make it slideshow so that it's bigger.
It's slideshow on my screen. That's what's interesting.
Oh, interesting.
If I mess it up again, let me...
All right, don't worry. Leave it like this. Leave it like this. Can we see it? Can everyone see it? The tips.
Yes.
You can just
Yeah, I can.
All right, good. Thank you. Right. So I was talking about trying to remember who you're addressing and phrasing your questions accordingly. And if you have forgotten who you're addressing, don't panic. Just say, sorry, I need to just check your notes again and be sure. Because you don't want to continue in that state of confusion. The chances of you being able to pass or recover is lower if you're not sure who you're speaking to. Sometimes you might have to get a lot of collateral history. So when you're speaking or getting history, I need to put in that caveat, depending on the type of station it is, that, oh, I might still need to, for example, speak to the school, speak to the teacher, speak to other parents involved, those kind of things. And the other thing you want to do is you want to keep the patient at the center of the consultation. So you come across stations that maybe you need to speak to the relative, and the relative is like, oh, I don't want my father doing so and so. They have their own agenda, and you need to think about, because as a psychiatrist, the other role that you play, apart from doing a risk assessment, is being an advocate for your patient. So you need to advocate for your patient at that very point in time. So these are just some tips, not exhaustive. I don't want us to waste too much time. I want us all to have the opportunity to practice. So we're going to go straight into trying out one of the complex stations that has come out. Dr. Tosin, can you move to the next slide, please?
Practice station 1. That's what I'm seeing here.
Yeah, that's the next slide.
Is that what's showing right now for everyone?
No, we are still on tips right now.
What's being projected right now? Is it station 1 right now?
No. Yeah, now we're on station 1. Thank you. Anybody wants to volunteer to do this station, please? Anyone? To do this station. So it's probably a station that we've come across before. Somebody who believes that she's dead and brought to A&E by her friend. She had lit a bonfire, and look at what the task says. Is the delusion primary or secondary? And then you need to do a risk assessment. So who wants to start this station for us? You can just raise your hand or shout out.
I can start the station.
Okay, that's Anthony. Okay,
Yeah.
thank you. So I will give you, I'll just give you, because we've run out of time a little bit. So I'm going to give you 60 seconds to prepare for the station. I'll let you know when it's time to start. Okay, and I'll let you know when you have 1 minute left. Right?
Thank you. Thank you. Can I start now?
Yeah, so you have 60 seconds starting now. Start station.
There's a bit of echo. Hello.
Please, if you're not speaking, mute yourself, please. If you're not
Hello.
speaking, please mute yourself. Yeah, go on, Dr. Anthony.
Hi, I'm Dr. Anthony Wadi, and is that Emily Roberts?
Yeah, yes, doctor.
Hi, Emily. I'm here to speak to you regarding what's been happening so far. Can I just know how things has been for you, please?
Doctor, I don't know why I'm here. I am dead. I don't need to be here. I'm dead.
Okay. And why do you think you're dead?
I know I'm dead. I died 3 days ago.
Mm-hmm. And when did this feeling start of being dead? Was it 3 days ago?
It's not feeling. I know
So
that
you
I
know you're
died
dead.
3 days ago. And I need to go and complete my, my final rites. So you need to let me go.
I appreciate where you're coming from, and I'm here to support you, Emily. Emily, can I just check? Is there any reason why you feel you're dead? Any evidence to show you are?
Because I know that I'm dead. The angel came to me and told me 3 days ago that I was going to die that day. And I know that I've been dead. I've been dead since then. So you need to let me go, doctor.
I understand where you're coming from, and I'll address your concerns soon. I'd just like to know a little bit more about what experiences you're having. Do you also have experiences that you don't have enough money?
Money. What about
Yeah.
money? I don't need money because I'm dead.
Or okay, is there any part of your body that you think that is dead? I know you said you're dead.
All of my body is dead, doctor.
Okay. Do you think some people are out to get you by any chance?
No, maybe, I don't know. Maybe, but they're wasting their time now because I'm already dead.
Okay. Do you think you're somebody special? I know you think you're dead.
No, I don't think I'm special. I don't know why the angel appeared to me, but I guess was just letting me prepare myself. So now I know I need to go and finish my final rites. That's all I need
And
to
how do
do
you,
now.
okay, and how do you intend to finish this final rite?
Yeah, I was trying to carry out a cremation before
Hmm.
someone then brought me here. That's what I need to go and do, doctor.
Okay, and how did you do the cremation? Tell me more about the cremation.
I haven't done it yet. I was just trying to light a fire in my back
Hmm.
garden, and then
Hmm.
um, someone brought me here. So I just
Okay.
need to go and finish that off.
Okay. Can you tell me more about the lighting of the fire? Why did you light it in particular?
Well, that is what I feel. The angel said I need to, that I was going to die, and that was the way I needed to prepare myself for, for burial. I don't want to be buried in the ground. I just want to be cremated.
Okay, so you set up the fire because the angel said you needed to die, and you tried to harm yourself by cremating yourself by setting the fire. Is that what you mean?
Yeah, I'm not harming myself because I'm already dead, doctor.
I understand where you're coming from. Can I just check? Were there any other people around there when you lit the fire?
I don't know. I was not looking at anyone. I just wanted to do my business like I was supposed
Okay.
to.
Was it next to someone's property, or was anybody standing next to you? I'm just concerned if anybody else might have been hurt by the fire.
No, I've not, because I've not been able to even light the fire. But I do have neighbors, if that's what you're asking, doctor.
Okay. And how's things been with your neighbors?
Fine, I don't bother them, they don't bother me.
And the angel that's telling you to light this fire, has it told you to light up and harm other people with this fire?
No.
Okay, it's just to burn yourself. That's what the angel is telling you. Is that right?
Yeah, I just said I was dying and I needed to
Mm,
carry out cremation.
mm. So this angel that you see, you hear the voice. Is it just what you hear them speak as well from what you're saying?
Yeah, it was
Um,
just one angel I saw three
only
days
one
ago.
angel. Okay. Do you hear any other voices?
Uh, no,
No. And do you see any other thing apart from the angel?
no, I've only seen the angel once, and that only that one time.
And how convinced are you that this is an angel?
Because of the way the I saw the angel, it had wings.
Yeah,
This was
yeah,
very bright, so I knew it was an
yeah.
angel.
Did anyone else there see the angel as well with you?
It was just me. It was just
Or
me,
just
doctor.
you?
Doctor, can
And
I go? Because I really need to leave now.
I'm afraid I'll just have to ask you a few more questions so I can see how well to support you. Okay? Can I just check about the angel you said you saw? Could you mind me playing tricks on you by any chance?
I don't think so, doctor.
And how's your mood been since all this started?
My mood since
Yes,
3 days ago.
yeah, and
I
even
don't have a
before then,
mood. I don't have a
you
mood
don't have
because
a
I was
mood.
dead 3 days ago. So my mood,
Are
my
you
mood
able?
doesn't matter.
Okay, it doesn't matter. Are you able to enjoy things that you like to do by any chance?
I've not been enjoying anything. I've been preparing for my burial. 1 minute left.
Are you okay? Do you still look forward to leave? You said you've not been looking forward to leaving, so you're preparing for your burial. How's your sleep and appetite been so far?
I've not been eating because I'm dead.
Hmm.
So I've not been eating. I don't need to eat. I don't need to
Yeah,
sleep. Yeah.
I'm quite concerned about that. Have you been losing weight as well?
I don't know, doctor. It doesn't matter because I'm dead.
Right. Have you been using any drugs or alcohol to cope since all this started?
No, I've not been taking any drugs or alcohol 3 days since
Okay.
3 days ago.
And then, have you been diagnosed of any mental health condition before now?
Yes, I was told I had depression a few years ago. Yeah,
And how has it been treated since then?
I had antidepressants, but I stopped 1 year ago.
And after 1 year
Time
ago,
up,
this
time
really
up,
started.
time
Thank
up,
you.
time up,
Thank you.
time up. Thank you, Dr. Anthony.
Thank you.
Before I say anything, what is your reflection on this station? Is it something you've practiced before?
I
Oh, you're on mute, Dr. Anthony.
Sorry, it's not something I've been practicing before.
Okay.
I've never done it before. It's the first time, and it was the spur of the moment. So my thought was a bit over the place. Yeah.
Okay. Okay. It is a difficult station, and just to say, the way I've acted doesn't mean that that's how it's been acted in either mock or that's how it will be acted in exam. So just to say that. But I think there's one key thing, because I know you were trying to look for depression and probably delusion of poverty in this patient. But I think it's the way that you went about it, because you kept thinking about 3 days ago when she was already dead. So one thing that you could have done to help yourself is think about what happened before 3 days ago. That's when I can give you, because I believe I'm dead and I'm not functioning. So I can't actually, if I believe I'm dead, I can't tell you there's all the things you've asked me will be no, 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 because I've been dead since 3 days ago. But if you ask me before 3 days ago, like 3 months ago, 6 months ago, what was my mood? What was going on in my life? Did anything happen? What happened before I saw the angel? Because you need to find out. is it a primary or a secondary delusion? So because you were only able to get the power of the angel, you didn't find out what happened before I saw the angel. Maybe I saw a sign and then later on I saw the angel and all of that. And if you had asked what had happened before 3 days ago, I would have been able to give you some information about how my mood was, and maybe I lost a lot of money, maybe my husband left me, blah, 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 and all of that. You would have gotten that kind of information. And the other thing is, you did try to assess the risk in terms of risk to self. And obviously, I still want to go and carry out, do a bonfire and cremate myself. That's high risk. In this kind of stations, especially when it's 1 minute to the end, it's not a management station, yes, but you need to kind of tell the examiner, you said, I'm very worried about you. Next thing you need to say, you need to come into hospital. I can't let you go, because I kept saying I want to go. So because the examiner needs to be sure that, okay, if you see this kind of patient, that patient is not going. You're not going to say, oh, go home and we'll send the community mental health team to come and look. You're not going to do that. Do you understand? So you need to actually say that in the station towards the end. So that's my brief tip about that station. But I want to ask if does anyone have any questions? How do people think we could have tackled this station so we'll be able to get the delusion, assess the risk properly? Any contributions from anyone before I ask Dr. Tosin to give his contribution? Anybody? Okay. Dr. Tosin.
Thank you very much. Can everyone hear me okay? Can everyone hear me?
Yes.
Yeah,
Okay.
Yes.
So for seeing the station for the first time, so that was not a bad attempt, really. There were a lot of positive things. It was nice that you reassured her. I appreciate where you're coming from. I'm here to support you, and you did as much as a task as you could, and then time ran out. Your manner was good. It looks like you can't, like, so you were quite clear, confident. So these were many good things. I suppose if I was just going to run through the things just to be mindful of, because it's a few days to the exam, so I believe at this point, you might want to take a step back. So on one hand, there could be specific feedbacks like content in terms of doing the task, which is very important, because 8 minutes is just enough time, or is it 7 minutes? So the time is just enough for you to do the task. So you have to prioritize the tasks first, which is abnormal beliefs, primary, secondary, and then risk. So whilst that's one level of feedback, so you asked a lot of things that were not central to the task. So that's why your time ran out. And then so taking a step back into, because it's a few days to the exam, in terms of how you approach the station. So you have to realize that you've got just about 7 minutes. You're supposed to be like a registrar. So you're supposed to be the consultant who's going to be the examiner is going to have to make a decision. Do I want this gentleman as my registrar? So how you start, you have to look after your psyche a few days before this exam. You have to be in a great mind state. You have to be able to psych yourself up. You have to enter confidently. And it's nice to your empathy at the start for this lady. So good afternoon, Mr. Roberts. I understand that last few days might have been stressful for you and you've had quite a difficult time. So I'm here to support you. And you can tell me what's been going on. So you want to start with open-ended questioning. That would have saved you at the end. You were asking things like, what you did the fire, or anybody around. So that's kind of like the risk assessment. But if you had started more with why open-ended questions, then you can reflect it towards the end of the risk. So say, for example, at the end, so that's where the showmanship comes in, because you're trying to signpost to the examiner that I know what I'm doing here, and risk is at the heart of this. So saying things like, Mr. Roberts, things have been quite difficult for you, and considering the fact that you're still having these thoughts of getting rid of your body, people were at home when you did it, I'm quite concerned about you, and I would like you to come to the hospital. So however you say it does not matter as much as what you communicate. So I cannot say that enough. So you have to be yourself in terms of how you pass your how you get the job done. So Victoria might say things like, I want you to come into the hospital. So she's communicated that, she's spotted that level of risk. I might say a different way. I'm concerned about you and I'd like to chat with you further. So the examiner sort of knows that you've picked that up. Does that make sense? So in a nutshell, I will the task, focus on the task, be sensitive to the settings of the task and the scenario. You're a registrar, you're supposed to be acting without direct supervision, really, in most cases. And yeah, so I feel like that's a very good attempt, but just some things to be mindful of. I hope that makes sense.
Yeah.
Okay, thank you very much. I don't know if you're able to move the slides, Dr. Tosin, to the next slide. So just some little tips. Yeah, just give it a try.
Is it moving?
It hasn't moved yet. It's still on practice station 1.
Moving here, that's the problem. Tips of 1. Still so.
Okay, don't worry. Leave it here because I can just rattle through the tips very quickly and you do the station 2. Oh, you've taken it off again, Tosin.
Yeah, that's because I'm borderline. Has it moved now? Can you see it now?
We can see station 2. I think let's leave it here for now.
So that's practice station 2 is clear, yeah?
Yeah.
All right, fantastic.
Yes. So just to just say is that for that kind of station, we've just to say risk assessment is important. Use the appropriate phrases, So because this person has said, I am dead, you need to find the way that you word your questions. You need to be careful about it. So, okay. So you said you were dead 3 days ago, Mrs. Roberts. So what happened before that, before you died? You understand, according to how you feel, because you felt you were dead. So you're not saying that you're not agreeing that she's dead, but you need to try and phrase it in a way that she'll be able to give you a response, if that makes sense. And everybody will have different ways that they would put across that question. I really think it's important in that station to mention, because the examiner doesn't know what you are going to do with that patient. It's only 7 minutes that examiner has to assess you. So I think it's important. You can say, I can chat with you later, but I do want you to come into hospital. Not giving the impression that you're going to let that patient go home. So I think we don't have a lot of time. The good thing that you also did as well, Dr. Anthony, is that you were able to check the degree of the conviction. Is she sure that it was an angel? Could it be something else? Sometimes using words like, is your mind playing tricks on you? It depends on the simulator. Some people don't take well to that. So you might need to think about other words. Is there any chance that you could be mistaken? Or is it, do you think that there might be an issue with your mental health that is making you to think this way, using that? But mind playing tricks on you, some examiners, some simulators don't really like that word, because it's almost like, to some people, it feels like you're putting the blame on the patient, that it's their mind. So people have different reactions to that. So you might think about other phrases to use. So Dr. Tosin, over to you to handle station 2.
Thank you very much. So
could you put on your camera?
I didn't turn on my camera. Can everyone see the screen right now? And can everyone see my face as well? Okay, so you can see my face, and it's station. Is it quite clear that it's practice station 2 on? Is station 2 on the screen?
Yeah.
Okay, fantastic. Yes. Fantastic. So I'll try to run through this. So psychiatric trainee working in an outpatient learning disability team. You've been asked to see Felix Trenton, 27-year-old man who's attending the clinic. He has a mild intellectual disability and autism. His care home has mentioned that they have concerns about recent change in his behavior. So I think my approach here will be, if someone wants to volunteer, and then we could discuss it afterwards. I think that might work a lot better. So who's happy to volunteer? Who's happy to? The beauty of volunteering is that you simulate the anxiety for yourself, because it's quite distressing acting in front of a lot of people, really. So that already puts you on that tempo of how would you do in the exam? Because very, very nerve-wracking, really. So yeah, this might be a good simulation for the exam. So who's brave enough? Come on, guys. Come on, guys. Who's brave? Who's brave? Who's brave?
We don't want to just call on someone might have to do. Could anyone just please volunteer? We don't have lots of time left. Femi, are you able to do this station for us, please?
Yeah, please. I'm actually like I'm cooking, but I'll do the next one. I'm failing it. Yeah. I'm just cooking.
Okay, who's able to do this station for us? Timmy, Mabel, somebody, Justina. Just give it a try. Don't worry about it. This is the time to make any mistakes so that for the exam, you'll be very prepared.
Don't know the station, but I can try.
Yeah, give it a try.
Okay. All right. So I suppose this should be, is it 90 seconds? Should be 90 seconds, right?
I'll give you 1 minute because of time.
Okay.
Because of time, I'll run out of time.
Okay. Are you comfortable timing or should I time?
I can time, that's fine.
Just because I might get lost in the acting.
Yeah,
I want to put on my Oscar acting performance.
I'll time,
Okay.
don't worry.
All right. So is everyone happy for 36 seconds?
Yep. Let's start station.
Hello, my name is Dr. Abumari. I'm one of the doctors from the psychiatric team. Are you Felix Trenton?
Oh, yes. Yes, I am.
I have not to come have a chat with you. The workers in the care home, they've been quite worried about you since it's been a recent change in your behavior. Can we have a chat about that?
Well, yeah, we can have a chat about that.
Okay,
I'm not concerned. I don't know what you're concerned about, really.
Okay. Do you have any idea why they would be worried about you?
Well, I mean, I'm just, I don't know. I'm fine. I don't know why they're worried about me.
Okay. I understand you have mild intellectual disability and autism.
Yeah, they said so.
Okay, and when you go for your clinics, how's everything been?
Well, I suppose everything is fine in clinics.
You're happy with your care so far?
Yes.
Okay, who do you live with?
I live in a care home. I live in a care home and everyone's saying I've just been getting angry about. I don't see what concerns about that is really. But I've been in the care home and yeah.
Can you tell me a bit more about that? What exactly is making you so angry?
I mean, just there's been a lot of noise and yeah, so Danny used to stay behind me in the care home, but she's had to be moved. Yeah, so I've got this new resident and just makes a lot of noise and no one seems to listen to me. So I just act out to get my message across, really.
That sounds a bit distressing, but can I ask who is Danny?
Danny is one of the new residents in the care home.
And she got moved.
Yeah, so I used to like who was there before and we used to get on quite well.
Yeah.
And so this gentleman was not new there, so everything is just really just messed up in my head, and just is a lot noisy. No one's gonna listen to me. I'm not getting my usual sleep, so I'm just I'm just really worked up more lately, really.
I see. So you're very close to Danny, and they moved Danny, and they brought in a new member of staff, and you're not very close with them.
Yeah, so it's a new resident they've moved in, but added to that is a new member of staff that they don't even know what my routine is really. So yeah, everything just feels very chaotic.
Yeah, so it seems like you're struggling a bit in the care home. Is that right?
Yes, I am.
Yeah. So when exactly did this happen?
The last few weeks, I can't remember the exact date when it started.
And since then, seems like it's been really affecting your mood.
Oh yes. Oh yes.
And how would you say it's affected your mood?
Just makes me really upset. Makes me, and then I just scream and I can lash out at people sometimes, I think.
We try to speak to anyone about it.
Oh yes, but they don't listen to me.
Yeah. I'm sorry to hear about your difficulties. So, how's your energy levels been? I know you said your mood has been, a bit affected about it.
Well, it's been all the same. Not much changes really.
And at this time, what do you think would help?
Well, I mean, thank you for caring about me, doctor. I suppose if I could get Danny back and nursing staff that know my routine might be helpful.
I can see that. And so far, have you been able to cope?
Just try to sleep the day off really.
And I know you're in a care home, and I'm not very clear on how the amount of access you have to things. Are you coping with, alcohol or anything like that?
No, that's not allowed in the care home, no.
Okay. So have you used any drugs at all?
I used to do in the past, but not lately.
So from what you're telling me, it seems you've been struggling a lot in the care home. Have you ever felt like life is not worth living?
Occasionally.
And you get so angry that you want to hurt someone?
Like I want to hurt some. Well, I've hurt a lot of people in the care home, really.
So would you say get aggressive at times?
I've had to do what I had to do.
Okay. Thank you for answering my question so far. Um, Thank you for
All
answering
right.
my question.
All right. Thank you, doctor. Are you done?
So I think she's done for now. So you had 1 minute, 30 seconds still remaining, but yeah.
You know, when you finish too early, you're either extremely bright or you missed out something.
Yeah, I was going to formulate a plan, but then they said you're not required to formulate a plan.
Well, okay. So are we going to let the time run out? Because sometimes that could be helpful. So you deal with the anxiety that comes with.
Okay.
Or we just jump into the feedback.
I've just
Alright.
stopped the timing already. Sorry.
All right. So I should go with feedback, yeah?
Yeah.
Okay. I think your manner was great overall. Your manner was great. Your rapport was good. I don't have any faults there because if you want to get information from someone, how you approach it does matter a lot. So I don't have any concerns there. You might have to bear with me that my acting might not have been fantastic because intellectual disability autism, and I'm not familiar with this station where you speak with the candidate directly. What I'm familiar with is discussing with like collateral. That's what I'm familiar with. But either ways, so I'll just give a general feedback. So it was nice that you used open-ended questioning. It was nice that you got me talking. It was nice that you asked me about being aggressive to other people and me to myself. Those were about the best parts. It was nice as to how you try to clarify, Danny. So so you essentially did the task in terms of cultural factors. But just what to keep in mind is this. This station is very, 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 very straightforward, and this station should be easy. Very straightforward. Why is it straightforward? So what you want to do is you want to know what's the exact concern first, which you asked me now. What are they concerned about? So it's just about how you phrase that might be, because if you've got learning disability and you're asking them what behaviors have they got concerns about, so you have to be careful there. Or what's been going on? What's your understanding of what's been going on? What's your understanding of is anyone at all having any concerns about you right now? So just be careful there. But what the structure should be the presentation itself, and that will have stuff like onset, duration, aggravating factor, relieving factor, as that changed, things like that. So you want to know exactly what the issue is and then the risks attached to it. So you really want to be clear on that. So this session is very straightforward, regardless of how it comes. So after you've done that, so you've clocked that presenting complaint really, really well, along with the risks, then you do biopsychosocial, because you want to know the causal factors. And that's why, okay, when you just start, what was going on prior to that? So you want to start opening a question, what was going on first? And they might give you, they might not give you, and then you start going specifics, any physical concerns. Sometimes it might need to be very specific. Have you seen a GP recently? Any headaches, chest pain, tummy pain, any physical at all, any past medical conditions, or any medication. So biological, you want to just quickly. Psych, that's where any drug use, alcohol, what's mental state like? Just quick general questions. Have you had any unusual experiences, seeing things or hearing things? And then good social. Because if I was going to be difficult, and you have to go, you might have to go through all that, then ask social in terms of, has there been any changes in the care home? In terms of the staff, in terms of the residents, in terms of your family? Do you have any social connections at all? When was the last time you got visited? In one of the scenarios, I think he goes home, he gets abused at home and things like that. So you want to just touch everything. And once you touch everything, just give a summary at the end. So the summary, you are not formulating a management plan. Now, this is extremely important if you want to get a very good score there. So the summary is more of you're formulating the problem. So an example is that. So thank you very much, Felix. So you've told me that for the last 6 months, you've been having some behaviors due to this. So hence, I'd like to speak to you more to see how we can help you. So that signposts to the examiner that you've gotten everything out. Does that make sense? So if you're speaking with the patient directly or you're getting collateral, that end bit also makes you finish like a boss. It makes you finish like the register that you should be in terms of, so you're a formulation of the problem. So you've gotten everything out. So the formulation, I'm going to repeat that again, should contain what they're presenting with, the risks and then the causes, because that's what you're doing in formulation. So if it was the collateral, for example, so thank you very much. You've told me about Felix, who for the last 6 months has been becoming more aggressive and has been harming people. And this all started when the care home underwent a lot of changes, and he's also been having problems with alcohol and drugs. So I'd like to see him and look at how we can best support him. So that way you've captured everything, and then no examiner will fail you with that. How would that make sense?
Yeah, thank you.
Thank you. Yeah, just my 2 cents as well. That so just like Tosin talked about, I need to speak with you further. You might need to speak with the people in the care home. So you might want to also talk about it in that if you're speaking to this the person with learning disability, thank you for telling me this. I need to also find out some information from the care home. So it shows it's still part of your history taking. You're showing to the examiner that you're looking for collateral history as well to take. And because to be honest, you did a very good job of developing rapport with these patients. I think your questions were simple. You don't want to, for a learning disability patient, you don't want to ask more than one question at a time so that they're able to understand. And then if they have autism as well, you don't want to use any language that they could misinterpret because they don't understand metaphors. So you have to be direct, very direct about it. And then in the causal factor, so if this person has already told you this is the reason, it's Danny or somebody that is causing this, a change in my routine, because you will get 1 mark for maybe checking social factors. But if you don't check for physical health conditions, if you don't check for other comorbid conditions, like is there psychosis or depression, you're not going to get the full marks for causal factors. So even though you've got what, you've got the reason why from this person, you need to check those other causal factors to be able to get the full marks. I hope that's clear.
Yeah. Thank you. Thank you.
Yeah. Should we go to the next
Can I say
station?
one thing, just 10 seconds? And that's what makes that's what can make, and that's why I cannot stress this enough. A few days to the exam, you should be thinking more about your structure and your approach rather than being obsessed with the content, because content changes. Why I'm saying this is because on some day, and the examiner, so there's no set way of how this is how you must do to pass, because even on the day of the exam, they sit, okay, what's going to be the marking scheme like? So if you have a structure, because my feedback and Victoria's feedback were quite different. If you have a structure that touches everything, so that way, regardless, so the idea is to be structured and have, this is how you're going to approach it, set the scene well, good rapport, empathetic at the start, and then make sure you touch all these things. Yeah, that's just it. Thanks.
Okay, please can you put station 3? So
There's up this. Is it moving now?
it hasn't moved yet.
Is he on station 3 right now?
No, not yet, sorry.
I mean, it's showing station 3 on my screen. So should I, before I mess it up again?
Don't know what you did last time to make you move.
Okay, so because it's 3 now. Is it 3?
No.
Still not 3.
Yeah, now 3. So maybe
right.
there's just a lag in the network. So
Highly
it might
likely.
yeah. Okay, so Femi, are you there? Because I think you did volunteer that are you okay to do this next station?
Oh yes, I am.
Okay. All right, great. So I will just start timing for 60 seconds now. Yeah, I can do this one. Yeah. Start station.
Hello, Miss Stone. My name is Dr. Femi. I'm one of the psychiatry doctors here. I understand that your daughter Rose was admitted to hospital yesterday. Can we discuss more about how to a diagnosis and how best to support her going forward?
Yes, doctor. I don't really know what's happening with her. Really worried about Rose.
And it's quite understandable that you'd be quite worried. I was just wondering, could you tell me more about what happened yesterday?
Yeah, I just know that I got a call from school that she had collapsed in school.
Right.
And then I thought, was it that maybe she didn't have enough to eat? I brought her home, but she's not speaking to me. She's not taking any food or drink. I don't really know what happened.
Mhm. It's quite understandable that you'd be distressed with what's happening. And I also understand that since she's come to hospital, she has had some tests done, and we are still trying to understand like what's going on. I was just wondering, before the collapse at school, did anything change, maybe at home or in her life?
Well, I don't know. Well, Rose and I used to be quite close.
Yeah.
I don't think she's told me that anything in particular has changed.
Okay. And was there like maybe like anything that could be that could be causing some stress?
Like what, doctor?
Yeah, maybe like a change in the family situation, maybe like some information coming to light, just any stressor really.
Well, doctor, the only thing that's happened, so last week Rose's uncle got arrested, and it was quite a shock for the whole family. We found out that he was in possession of child pornography. Um, so that's the thing I know recently that's happened, but I mean it shocked all of us. I think Rosa as well was shocked. I don't know. Is that the reason? Do you think that's the reason why she's what's caused this, or?
I would like to ask a few more questions about that incident, if that's okay.
All
So
right.
was Rose close to that uncle?
Yeah. He used to come. He comes to our house quite a lot. Yeah. It's her favorite uncle as well. We're all very close to him.
Okay. And did Rose discuss like the issue with you, like further?
What issue? Sorry.
No, I meant the arrest. Like, did Rose maybe like, was she like maybe fixated on it or really worried about it?
We were all shocked. Like Rose was shocked as well. But no, she didn't really discuss anything with me.
Okay. And prior to the collapse, how would you describe her mood as?
Yeah, she's just a normal school girl. Like she has friends, goes to school, comes back. I didn't notice any issues.
Okay. And would you say that she was interested in things that she used to enjoy doing before, like she came to hospital?
Yeah, I think so.
Okay. And I was wondering, did you also notice that maybe she had like maybe any unusual experiences, like maybe responding to voices that maybe other people couldn't hear or see things that other people couldn't see?
No, doctor, no, I don't know of any.
Okay. And did Rose have like any like say physical health problems before before this time?
No, I don't know, but obviously for her collapsing, I don't know if that has something to do with her physical health, but she's always been a very healthy girl.
Okay. And did she have any contacts with like mental health services before like this time?
No, doctor.
Okay. And was she on maybe like any medication or maybe any treatment?
No.
Okay, okay. I just want to say thanks for speaking to me because apart from like talking to you, we have also done like a medical assessment and we've done some tests and we can't point to a physical health cause for a collapse yesterday. However, we do feel that she might be experiencing a condition called conversion disorder. Have you heard about that before?
No, doctor, what is that?
Okay, so this is like a mental disorder that happens when like the body responds unconsciously to um maybe like a stressful life event or an acute change. And from discussing with you, you did mention that Rose's uncle was, arrested last week, which was a shock to everybody. And it seems that she was quite close to that uncle. So, putting that together with the fact that we've done like a full medical assessment, we've done tests and we've not found the cause, it's likely that that arrest and the shock of it could be causing our difficulties.
Okay. Right. So, doctor, what can be done?
Yeah, so I think that we've started off like on a good note because like you're supporting her, you are keen to ask questions, which is good, so we keep supporting her. And then in terms of like medical care, she's already receiving good medical care and we also like continue that. And apart from that, we can also offer like maybe like talking therapy when she comes to, so that we can help her
1 minute
process.
more. Go on. 1 minute more.
Okay. So that we can help her process what has happened and we can support her going forward.
Okay. Doctor, is there anything that I can do to help her as she is now?
Yeah, so I think like you can like support her and you can offer her reassurance and then we can take things from there.
Okay. All right. Thank you, doctor.
Thank you so much.
Okay. Yeah, you had about 25 seconds left. Okay. So, before I give any feedback, because you gave a diagnosis of conversion disorder, could it be anything else? And why do you say conversion disorder? What is the difference between conversion disorder and somebody who has dissociative stupor, for example?
Honestly, you're absolutely right, because I actually struggled with the diagnosis. So I was just trying to like work, and I think I struggled with those, I think like functional neurological like symptoms and disorder, as in functional neurological symptoms or functional neurological disorders, really. So yeah, I think in dissociative, I'm not sure. I don't want to just
Okay.
it's not my strength.
Okay. Okay. Thanks anyway for attempting the station, Femi, because I can say that, I think you did try to develop rapport with the patient. And I think you did try to practice reflective listening in parts of the station. I think for conversion disorder, usually it's like the person presents with like a part of the body not being able to function properly due to stress. So both of them, dissociative stupor, conversion disorder, it's in relation to stress. But in conversion disorder, it's usually like a part of the body. It could be anything ranging from blindness, they can't see, and there is no organic cause for that, or they can't raise their hands or they can't raise their feet properly. There's no organic cause for that. Or for dissociative stupor, again, it's also going to be different from catatonia, because in catatonia, they are not moving, they are just in one position, they are not able to move at all. So I think in this kind of station, you want to actually clarify, is this catatonia, is this dissociative stupor? Because is she moving? If she's not speaking to anyone, if she's not eating or drinking, is she just stuck in one position? You want to try and clarify that if that information is not given to you in the station. But to me, this person is experiencing dissociative stupor. Okay. So there was a psychological stress or conflict that person found overwhelming, and that caused the mind to go into a shutdown, and that also caused a ripple effect on the body, so the body completely shuts down. Even for catatonia, it will probably be the same kind of explanation, that we tend to see catatonia in people who already might have schizophrenia, or they might have a depressive disorder before. Do you understand? But anyway, going straight to the station. So I'm just going to ask if anybody knows what was the hidden task in this station that maybe we should have asked. Does anybody know? So because Femi started on it, but he didn't explore it fully. Anybody have any idea what the hidden task was?
I think probably, is it a risk, or I don't know.
Yeah, the
Yeah,
risk. What
yeah,
did you not do in the risk?
yeah. Because so he's 16 and our uncle was arrested. So I think I should just have asked that, could there be any chance that maybe our uncle had molested her? Did that information come to light as the police requested for an interview? And yeah, so, and some other questions that I could just have asked around that, because I think I just brushed the surface, but I could have gone in like deeper.
Exactly. But you have
Yeah.
to also be careful how you do it. You need to ask it sensitively. So, an example, and this is not the only way, you could ask that, is there any possibility? You said Rose and her uncle are very close. Is there any possibility that something inappropriate could have occurred between them? Something like that, for an example. And the mother might say yes, no. But the reason you're doing this, so the examiner knows, because if everybody heard the same and Rose was affected specially, what was it about Rose that made her to go into a complete shutdown? So if you ask that kind of question, the examiner knows that you're thinking about it, that there's a risk that she could have been abused by the uncle. And it's something that we might need to explore. So depending on what she has told you, whatever the mother says, thank you for telling me. Maybe this is something we need to explore further.
But
And especially we can explore that with Rose, maybe when she's better and all of that. And then in terms of like speaking to the relative, when I think it's just good. It just gives you, I'll borrow Tosin's phrase, where you finish like a boss. So when you finish explaining what the disorder is, when you're speaking about the management, always think about the things that the relative can do or the patient can do, if that is possible, and what the healthcare professionals can do. Because this mother is really concerned about her daughter. It might not be right for her to go and start peppering her with questions right now, but just being supportive to her, and the relationship that Rose has with her already, just fostering that relationship, just saying something like that. It doesn't need, there's no specific answer for that, but it always makes it more of a humane conversation when you think about what can the relative do, what do we do as health professionals. And it's always good if you have a structure for your management. You might not be able to do this in every station because it depends on timing and a lot of other factors. But you might think, what do we do in the short term? Because now this person is not eating and drinking. So we need to keep her in hospital. It might mean that we might need to give her fluids. We need to make sure we monitor her nutritional state, in the short term. And when she recovers, then we can think about talking therapy. If she's not moving or whatever's happening to her, does she need physiotherapy in the meantime? So those kind of things, you never go wrong when you talk about management in form of a multidisciplinary approach. Like when you say that, the examiner is like, yes, this person knows. Even if they don't listen to what you say afterwards, they have that feeling that this person knows what they're saying. So just some tips on that. But yes, I think one of the things people struggle with, because they're always afraid to bring it up. They don't want the examiner, they don't want the simulator to be upset when they give a suggestion about, could the daughter have been abused or something like that. But you do need to say it, because the examiner doesn't know what's in your mind. You need to kind of bring it out, but in a sensitive way. Then you know that you fully did the risk assessment, because you're checking the risk to the daughter. If it has happened before, is it going to happen again? This person has been arrested. Does there need to be safeguarding? You can't say all of that in the station. But if you give that, if you're able to at least pinpoint that there's a risk there, then you've been able to do that for that station. Yeah. So see, any words? We've already run over, so I think we're gonna have to skip through the rest very quickly. Any?
Okay. Yeah, I wrote down some few things. I really loved your intro. Yeah, so you owned it, and that's what you really need for CASC. Your psyche has to be at that registrar level, and that sort of shows itself in how you set the scene, because everyone's going to make a judgment of you in the first few seconds. Really, we're all human beings, so setting the scene, getting there confidently. So you have to do a lot of psychological work on yourself, like you can do this, and this is your clinic. So I like the fact that I set this scene well. You asked any changes. So many good things. Not to repeat things, just to be careful in the sense that at some point when you asked any changes in the family situation, like any information coming to light, I appreciate that we get different contents, we've seen different, maybe, yeah, but just have to be very open-minded and be very careful, because that could, there'll be new stations on that day, new way. So not to be too particular how you think the station would go. Now, what I want to emphasize is when looking at each station, right? Is there any catch here? And using your intuition, you really need to be able to trust your intuition. In some places, so if you're immersed in the scene of the task where you are and your intuition, you know what you need to say, rather than this is what I must say. Just go with the flow. So important. I'm saying this because I don't think you needed to ask so many questions, because it says doctors lack a diagnosis. So if you think about it, ICD-10 for dissociative disorders, you only need just two things: no evidence of physical disorder that could explain the symptoms, and there's a convincing association of the stressful event and the kind of like temporal relationship. Although ICD-11 says that the first bit, they don't need to be any stressors. You can just have it for conversions, really. But ICD-10, my point is that once you can establish that temporal relationship, and I like what Victoria said in terms of if everyone heard the news that the uncle did this, why did it affect Rose? So highlighting in terms of how do you think that impacted on Rose? So that's the meat of the station. So you've shown that you've shown that there's an issue, there's a social stressor, and you've shown how that connects to the patient, and there are no physical health problems. So no organic cause. You've asked that already. So I do not think you need to ask. Because in the exam, you could have a patient whereby it has a lot of questions to ask you after breaking the diagnosis. But if you've spent so much time there, you're gone. So you need to spare your time between the history, the diagnosis, and leaving time to explain. Because she might take into management. I hope that makes sense. So that's all I have to say.
Thank you.
Thank you so much. I think just for everybody's benefit, please, I know that many of these stations, maybe they've been repeated, but you need to be careful the way you ask your questions. The examiner doesn't take kindly to like, oh, you feel you know the station, so you're trying to get, oh, for example, if you have a conversation on this other station and you just go and say, oh, so has there been any arguments between you and your husband, or has your boss fired you at work? Because that's what you've read in another scenario. It's a no. You have to keep your questions open-ended. You can now give an example. So that's a different thing. If the person is not now able to tell you, you can now give an example that, oh, maybe there's been any stress, for example, arguments in the home or problems in the workplace. You don't want to give a specific synopsis that you have read somewhere and you assume that's what's being asked in that station. The examiner will not take kindly. And also you might just miss, because they change the stations. Even if it's the same station, they might change some little bits of that station. So you don't want to go into that kind of trouble or difficulty during the exam. So I think we will have to kind of stop now, because we are only contracted for 1 hour. But just Tosin, I don't know if you can just look at station 4 and just speak about it briefly. We won't have time to practice it, and then I'll speak briefly on station 5 and we end.
Let me see. I hope my screen moves this time around. What are you guys seeing right now?
It's still 3 at the moment.
Is it still 3? Because I'm seeing 4 right now. Has it moved?
No, maybe it's that lag. Yeah, move now.
Okay. Okay, so you do require me to talk about this briefly, right?
Yeah, just very briefly.
Okay. Now, this is also very, very, very straightforward. Now, what I want to say is that whenever there's anything that looks like diagnosis, try go with a technical angle. Like in the previous session, we're talking about dissociative disorder. So what's the ICD for that? And then just focus on it. You only have enough time to do the task. If you're doing things that are not the task, that's when it looks like that you don't have enough time. So this station, if you see an elderly gentleman with 9 months history of confusion, what are you thinking about? Now, diagnosis criteria for dementia, it has to be more than 6 months. So if you're already saying 9 months, so that's a differential. Is it dementia? Is it delirium? It's not common that delirium lasts 9 months, but that's still a possibility, because some dementia starts with delirium, maybe about 5%. So in a nutshell, you want to take your history to encapsulate dementia and physical conditions. That's what essentially what it is. So what I said in the previous, you need to have your structure. So a few days to the exam. So don't be obsessed with the content, because you might get different histories, but just have your own clear structure. What's the structure? Onset, duration, how has this progressed? Is it better? Is it worse from the wife? Then biopsychosocial. So biopsychosocial, in the biological pit, any physical concerns at all? So you want sometimes, so you want to start opening questions. Has it been seen GP for anything, any concerns at all, any medication, any side effects? Then you might just have quick systemic chest pain, tummy pain, anything, just quickly, or urinary infections, anything you're concerned. So once the biological is out of the way, so biopsychosocial, psych bit is now mental state. So because your differential is dementia is a possible differential, so you might want to just run quickly through it in terms of diagnostic criteria. You want to know memory concerns, short-term, long-term orientation. So by now you should have those things as a fingerprints, visual spatial, personality changes. So you different techniques to it. Also some open-ended. Sometimes you may also, if you want to now if you want to use double-ended questionings, you might be smart about it. Some people say things like they might undergo personality changes where they do things that no longer themselves. Has it been the case with him? She might tell you or not, but just have to be quickly get questions for dementia. And then social bits, just tick the boxes. And at the end of the day, give a summary. That summary highlights what you've picked and what you hope to do. And that's how you just end the station. So thank you very much for speaking with me, Jane. So you've told me that for the last 9 months, is that increasing confusion since the onset of his UTI and things have not gotten any better. I would like to still speak to you more. I'm not quite sure what's going on right now. We will still need to do some further tests. There's a possibility that it might be dementia, but we would need to rule out any other further conditions before we make that conclusion. I hope that makes sense. So stuff like that. So it broadens your thinking in terms of your communicating because it could be this, it could be that, and that's the beauty of it. I hope that makes sense.
Okay, thank you very much, Tosin. So just if you can move to station 5, but I'll just try and talk about it very quickly. So just move. I know there might be a lag, but this station 5, I think it's a relatively newer station where maybe you've been asked to speak to a relative about maybe their relative had a road traffic accident, an elderly relative who is driving, and the relative has concerns about the mother's memory. So you now need to address those concerns. So you have to do two things: take a collateral history and address the concerns. So trying to establish what are the issues around this person's memory. Where are they actually having issues? Is it short-term memory? Is it long-term memory? Around that, also doing a risk assessment. When you think about older age risk assessment, there are many things you want to look at. You want to look at how are they able to function? Are they able to carry out activities of daily living? Has there been any accidents, falls? Have they gotten lost? You now need, because this is about driving, you need to ask some questions about driving. Now, we are saying you need to do this, you need to do this. You don't have a lot of time to go into each of them in detail. So you need to be able to, that's why having a good structure is very important, okay? So you need to have the questions already at the tip of your fingers that you want to ask. So for example, if you want to check about other associated risk, you want to know, does this person have any chronic medical conditions? Are they taking their medications or not? Or they forget that? Okay, so is this person living on their own? Are they cooking for themselves? Are they able to take care of themselves, cook, have a shower, clothe themselves, those kind of things? Are they doing the budgeting, shopping for themselves? So it might just be one question you ask on each, but as you are doing that, the examiner is checking that you are able to think about these different areas. Then you now focus on driving. So the driving, because there's been an accident, does this person drive all the time? Where do they drive? Have they got lost before? Blah, blah, blah. These issues in memory, has it been assessed or not? So you know whether that needs further assessment. Are they under a memory team or not? And then because there has been an accident, there are issues with memory. You can't do without mentioning DVLA. Okay, and it might be brought to you by the patient saying that they are really concerned because now they've had an accident. What if they hit somebody else with their memory? So what are we going to do about DVLA? And then there are 3 tiers of how you approach this, because remember, you want to put the patient at the center of the consultation. So maybe the son might have said, oh, I've told my mom to stop driving. She won't listen to me. Okay. And I've told her she needs to tell the DVLA about her condition. She won't listen to me. At the same time, you still want to bring it and say, look, we need to talk to your mom about this and try and convince her about the risk. If she doesn't listen, even a relative who is concerned can speak to the DVLA themselves about that person's condition and say they have concerns, and then DVLA will take it up. If that relative doesn't want to do so, because it's also in the DVLA guidelines that when you are reporting, especially on behalf of the other person, you need to think about your relationship with that person. Is it going to negatively affect it? So you want to kind of talk to the son about that a little bit as well. And if the son, is saying, oh, I'm not able to do this, even if the son is saying, I'm able to do this, the examiner wants you to be able to say that your responsibility is to keep the patient safe and the public safe. So you might need to be the one to inform DVLA. But there are those 3 tiers of information you want to try and quickly go through. I think if this comes out in the exam, I'll advise you to try and do that at least in the 1 minute remaining, while you talk about you in the first 6 minutes, you try and find out what's been happening, checking her risk, and then end it with that, the DVLA, and talk about other areas where you can support through the approach of a multidisciplinary team. So I think we're going to have to stop here today. We've gone 20 minutes over, but I hope it's been useful. And different people will have different ways they approach these stations, but having a structure is very important. Doing the task is very important. Doing a risk assessment is very important. There are very few stations in CASC that you wouldn't do a risk assessment. Most stations you need to do some sort of. So try and do it very well. I always tell people that, we tutor that in that last 1 minute. So if you've done all the information gathering and what, if you've not done a risk assessment, do a short risk assessment then, and then say the diagnosis or the management plan and end there, because you will not be able to do anything exhaustively. Yeah, I think, is there a question from Abu Mary? Any question?
Yeah, I was just wondering how you would do a risk assessment for this patient.
Oh,
Can I?
okay. Do you want to?
Yeah. So I mean, it's nice to hear from you, Victoria. It's nice to. It's really nice to hear what you had to say. But my opinion on the question, based on the question just now in terms of how to do risk assessment. So whilst for the person that asked the question, I think risk assessment is necessary, especially when you have to. But the higher level is your consciousness of the risk, being aware of it. Because sometimes you can't actually do risk assessments. But it's kind of like, don't forget that CASC is an exam that you're moving to a registrar and you should have practiced psychiatry for 3 years. So if you're seeing a scenario, what are the things you should be concerned about? Looking at this already, 75 years old, it's likely it might be budging around dementia. And part of dementia symptoms can be they don't have insights. So the mother might not want to. Do you see what I mean? So it's kind of like, has there been any concerns in terms of any accidents? What does she feel about it? So you have that awareness. And then they might want to stretch you by saying that if you tell the son to tell the and his son says no, mother says no, what would you do about it? They might want to stress you further. So you then having that, like, you have a duty of care. Don't forget there's what like the Tassarov's case, whereby if there's a risk to others, so showing that you have that awareness as to, I need to still do something. So we still need to, I might need to discuss with my consultants further, because if there are the risk that there could be harm to other people, we need to act. If family are not going to, it's just about how you phrase that, if that makes sense. So my point is that you might not always use the risk assessment. It might not be practical, especially when you have a task and more important things, but it's that higher level of your consciousness of the risks, because you've got just a few minutes and it's a showmanship exam. What are you worried about in this station? So how do you communicate that showmanship as to, I know I should be concerned in this scenario? I hope that answers the question.
Yeah, so I was just going to say, how do you do a risk assessment as well? It's similar to what Tosin has said, and I tried to explain, for older age, you are definitely kind of worried about their functioning. So your risk assessment is around their functioning. Any other accidents in the home. So you have some broad questions that you ask, maybe just 1 to 3 questions about their risk and their functioning. Risk in terms of, how are they able to carry out activities of daily living? If they have chronic medical conditions, are they taking their medications, or are they forgetting to do that? Have they been found wandering? Because you think, when you think about any other patient, maybe in general adults, you think about risk of vulnerability and exploitation, risk to self, risk to others. It's those kind of things. But knowing the kind of risks that are specific to older people, I hope that makes sense. People, especially people that you're thinking that might have dementia. So if they are having issues with memory, what are the risks that will be pertinent to them? And you won't have time to explore everything in detail. But if you can touch a few aspects, the examiner knows that it is in your consciousness, just like Tosin has said. Sorry, I think we really need to round up now, because we're really, really over time.
And Arsenal's game is starting in the next few minutes, yeah.
Yeah, this has been useful to people. So we'll put it up on YouTube. Thank you, everybody, for coming. Thank you, Tosin. Thank you, everyone. Have a lovely weekend. Thank you.
Thank you.
Yeah. Any other questions, you are welcome to put on our WhatsApp group, and we'll try and answer as much as we can. So make use of our WhatsApp group. It's not just for posting these things, it's for asking questions as well. Yeah. Thank you.
Yeah, bye everyone. Bye-bye.
Thank you so much.